Hi guys, it's Jazz Galati here, and I'll be just coming in at various moments, really important moments in this epic video, just to give you a few hints. Now, when it comes to air particle abrasion, I'm not aware of any evidence that when it comes to fixed retainers, what's better, 27 microns or 50 microns? Traditionally, for intraoral bonding, we use 27 microns, but you can use 50 microns. Now, you have to think, what are you trying to achieve by using air particle abrasion? For me, the main benefits for when it comes to placing a fixed retainer is twofold. Number one is you're removing the biofilm. Okay, so important to remove the biofilm before you do any bonding. And number two is that you help to remove the aprismatic layer of enamel, which may also cause an inferior bonding, basically. So you get higher bond strengths to enamel that's just below the aprismatic layer. Whoa, now you're thinking, but Jazz, I don't have an air abrasion unit. What do I do? Well, let's think. How can we remove the aprismatic layer and how can we remove the biofilm? Now, for the biofilm, I would use a bristle brush and some pumice slurry, and that will really help to remove the biofilm. And to remove the aprismatic layer of enamel, I would actually use like a fine rugby ball diamond burr, and I would just slightly scratch the enamel. You're only trying to remove like 30 to 50 microns of enamel here, so not very much. And for those of you getting very nervous about removing enamel, you've probably just done a whole lot of APR, so calm down, yeah? So when we see this image here in that still, the amount of etch that's applied is not enough for me. I want a little bit more surface area of etch. You should always be etching a little bit more the way you think your composite will be placed. So when the floss was introduced here and it was being placed, you were probably watching really closely. Okay, well, what's going on here? I don't understand. But now that it's in this position, i.e. you've literally just gone between the canine and lateral incisor on each side. And that's it. That's all that's happened so far. This is really easy. This is the beauty of this technique, because what I'm used to doing is I'm putting these little loops in multiple different areas, multiple different contacts between the teeth, and just overcomplicating it. I love this technique of just putting one piece of floss, not even two pieces of floss, one long piece of floss, okay, carrying it over, making two loops, which you're about to see, and this is just genius, rather than faffing around with multiple different flosses. Remember that placing a fixed retainer is a four-handed job, okay? While you're feeding the fixed retainer through, it should be your nurse who should be helping you by pulling this floss. And you should obviously have this conversation with your nurse before you do it for the first time. So show them this video, okay? Let's train your nurse together before you actually do the procedure, so your nurse is not looking at you funny like, wait, do I pull? How hard do I pull? When do I pull? Okay, all those things should be known to the nurse before you do this. Guys, this is the most beautiful part in the sense that you're using the tucker and you're pressing into the embrasure areas, into proximal areas where the contact is, to create that little bend. Now, you don't want too many bends and you don't want too extreme of a bend. And so how can you ensure that the amount of a bend that you have is not excessive? Well, if you make sure that your fixed retainer is along the contact point, so it's not too apical or too incisal to the contact area. You want to keep it at the contact area, therefore it doesn't have to bend into the tooth very much, okay? The other thing you could do is just lightly pre-bend your wire to the rough shape. That's going to help you, and then you're using that tucker, and you're putting a fair bit of force here to just press it against the tooth and kind of bend it in each contact area at the contact point, and that's what's going to give you that lovely shape that we all desire. Now, before you actually place the composite flowable here, here's what you got to do, okay? You just get the nurse or yourself or whoever's holding the floss to just let go a little bit and observe. When the floss is let go on one side, does the fixed retainer, does it sort of bend away from the tooth? If it does, then that is not passive. Okay, you need to do a bit more bending there to make sure it's passive. So an ideal retainer here is that when you let go of the floss, it holds its shape and it's not moving away too much, just like we discussed in the main podcast episode.